This may be one of the weirdest and craziest stories I have ever seen. Buckle up, ladies and gents. Put on your thinking caps. We got a conspiracy afoot. Mediaite reports White House hot microphone catches someone joking with Fox's John Roberts. Quote, "We've all been vaccinated around here." I'm sorry. Joking about saying it? Nothing they said were jokes. This is weird stuff. At the White House press room, somebody was setting up a camera and streaming before anything started. And Fox's John Roberts said some stuff. A guy said, "We've all been vaccinated." They were having a conversation. Ain't nobody was joking. Let me read this for you. Mediaite says, a White House hot mic picked up someone apparently joking with Fox News. While White House correspondent John Roberts, a White House hot mic picked up someone apparently joking with Fox News' White House correspondent John Roberts that, quote, "We've all been vaccinated against the coronavirus around here." As conspiracy theories about the coronavirus pandemic abound, a hot mic exchange from before Monday's White House coronavirus task force briefing could contribute to a surge in tinfoil protective headgear if it's taken seriously. Why wouldn't we take it seriously? They weren't joking, man. When White House briefings are streamed live, some outlets carry the feeds with audio and video long before the events start. On Monday, one such feed caught a sardonic masked White House denizen, possibly another journalist, greeting Roberts as he emerged from the lower press office. "What do you know, buddy?" the man asks Roberts, who tells him, "You can take off the mask. The case fatality rate is 0.1 to 0.3, according to USC. Roberts was referencing a study that evaluated tests on a representative sample of 863 LA County residents. Roberts' offhand advice, also potentially exaggerated for humorous effect, to take off the mask, is not included in LA County public health officials' findings from the study, which included the need to continue broad social distancing measures. I don't buy it. None of the journalists were wearing masks. Why are they trying to claim it's a joke? That's weird. John Roberts wasn't wearing a mask. The other journalists aren't wearing masks. We've watched the videos when Trump's speaking to the journalists, they're not wearing masks. John Roberts was legitimately citing a study, which is true and does say this, and telling the guy to take his mask off. Now, here's the weird thing. Really? That's reassuring, the man tells Roberts, then cracks. Everybody here has been vaccinated anyway. Without missing a beat, Roberts details some of the study's findings, telling him USC and LA County Public Health came out with a study that found that there are 7,000 cases in California, but they really believe there are anywhere from 221,000 to 442,000 people who are infected. As they both walk out of frame, the man jokes, "So it was a hoax?" To which Roberts replies, "No, I don't think it was a hoax." Even by optimistic standards, a vaccine is not expected until sometime next year. Watch above via NBC affiliate WPMI. They're not joking. The guy's genuinely asking if it was a hoax. John Roberts is genuinely saying, "No, I don't think so." The dude, why would he arbitrarily say, we've all been vaccinated anyway? Was he talking about general vaccinations, not COVID? I think that's the fair assessment. People are going to look at this and they're going to run wild and say it's a conspiracy. I've already had people send it to me like, "Dude, you got to see this." I think the dude was talking about vaccination in terms of we're not anti-vaxxers. We've had all of our, various vaccinations. Not only that, but journalists who travel out of the country, I don't know about the White House Press Association, but I've gotten a ton of different shots, like hepatitis A, typhoid. What else did I get? Yellow fever. They inject me all crazy because if you want to go to these dangerous places, man, you gotta get you gotta get a buff, right? The doctor comes in, he gives you that protection. I go to Egypt, I don't get sick. That's kind of the point, right? I think maybe that's what he's talking about, but I don't know for sure what he really means. I mean, there's no vaccine for this as far as we know. Could it be, confidentially, there is an experimental vaccine, and that due to the fact they're in the White House and around the president, they must have it? I'm not going to speculate, but I can tell you this. They were not joking because the studies are real. Check this out. 1/3 of participants in Massachusetts study test positive for antibodies linked to COVID-19 after giving their blood samples in the street at random. Boston, I don't know if it was Boston. Let me just read this. Nearly 1/3 of 200 Massachusetts residents were infected with antibodies linked to the novel coronavirus, according to a pilot study. It's from a couple days ago. Physicians at the Massachusetts General Hospital said they found evidence of widespread COVID-19 exposure in the city of Chelsea. Chelsea, located just north of Boston, had the state's rate of coronavirus infections at 1,900 cases per 100,000 residents. Researchers collected drops of blood from residents in Bellingham Square on Tuesday and Wednesday after advertising the study. Of the 200 voluntary participants, 64 had antibodies created by their immune system to fight the coronavirus. That means the mortality rate is ridiculously low. Now, let me show you these other studies, and then I'll tell you what this means. ABC News says antibody test study results suggest COVID-19 cases likely much higher than reported. This is what John Roberts was citing in that hot mic video. The testing is a joint venture by USC and Los Angeles. They found that the actual infection rate may be 55 times higher, maybe even 85 times higher, saying after testing nearly 900 people, researchers estimate that as many as 442,000 people throughout the country of nearly 8 million adults had the virus as of April 9th. That's just 5.6% of the population. So we have a long way to go, lead investigator Neeraj Sood, a USC professor of public policy, told ABC News on Monday. We're still early in the epidemic, and more people will likely get infected. The results were from the venture's first round of testing. The study by USC researchers and the public health department is ongoing and will test thousands more in coming weeks. Based on the results of first round testing, the research team estimates that approximately 4.1% of the county's adult population has antibodies to the virus. Now think about this. If they're saying it's 4.1, but a random sample found a third of people, that means if we only know about, 1,000, let's do it by 1,000. Let's say we know 1,000 people are sick because they're hospitalized. Let's say of those people we extrapolate, or I'm sorry, that's not how it works. We test 1,000 people. We find 1,000 people are infected. We find that 15 to 20% are hospitalized. Of those hospitalizations, we see some deaths. So ultimately, they were looking at like 1.4 to maybe even 3% of people would die from this. That's really high because the flu is 0.1. Now we're learning from multiple studies. Check this out. Another study we have here, Live Science, says way more people may have gotten coronavirus than we thought. Small antibody study suggests. So we have Stanford. We have Santa Clara. We have Stanford. We have USC. This one's Stanford. And then we have the random sampling out of Massachusetts. That could mean that the mortality rate is actually just maybe on par with or higher, maybe double the flu. Double the flu is still really, really bad. All right. Here's the important factor and why lockdown is still important. Why social distancing is important. Lockdown, you could argue because of the economy, and that I think it's fair. No immunity. The mortality rate for this is potentially double that of the flu. This is why we're seeing people die. I thought long and hard about this, and I was talking to some people. I'm like, if this is just a bad flu, like some have suggested, then why are we seeing all of these deaths? Because in New York, it's way higher than normal. In many places, it's way higher than normal. Infection rate. See, the coronavirus we have no immunity to. So lots of people are getting it. The mortality rate is substantially lower. We're still seeing people overwhelm our hospitals. It's really that simple. With the flu, some people won't get it because they have partial immunity from having it in the past or from inheriting some kind of immunity. But I've had the flu a long time ago. I haven't had the flu in a really, really, really long time. I don't want to get the flu, so. But when you get one flu, you might have potential partial immunities to other strains of a similar flu or something like that. When it comes to the coronavirus, it's novel. This is why everyone freaked out. We thought the mortality rate was high, that above of the Spanish flu back in 1918. Turns out way lower according to 3 preliminary studies. But we are still seeing lots of people die. To me, this actually makes a ton of sense. So far, we've seen 40,000 people in the U.S. die, and that is horrifying. And we've taken appropriate actions to try and save as many lives as possible. We weren't able to save everybody. A lot of people still died. But I think now we're learning the truth, and this is one of the reasons why we needed this testing, to know who has already gotten it so we can get a more accurate picture. Guess what? Now that we're learning the mortality rate is substantially lower, perhaps there's now a reasonable argument to be made that we can reopen the economy. Look, people are going to lose their lives. It's a hard decision to make. But there's an equation where when the economy is shut down for a certain amount of time, people will start dying from lack of access to resources, lack of access to healthcare. When people get sick from coronavirus, they'll die as well. It's a double-edged sword. There's no matter what you do, you got to grab it and you got to do something. We can't sit around doing nothing. But this is good news. So I don't know why they're trying to downplay what these guys were saying in this hot mic. I think it's weird, the mentioning of the vaccines. I'm definitely trying to explain it away. I can give you no real answer for why the guy said we're all vaccinated here anyway. So I don't know what else to tell you other than we got good news. These studies are good news. It means we're going to be safer than we thought, and people still lost their lives. People will still get sick from this. Take the entire population of the U.S., 27 million people. Take 0.12%, the low end of what the studies are showing us, and we're looking at hundreds of thousands dead. I think we can lock down for this for a certain amount of time until the equation dictates that we're going to do more harm than good, and then we'll have to figure it out. I guess we'll see how things play out. You tell me what you think about this hot mic. I'll see you all tomorrow at 10 a.m. on this channel. Thanks for hanging out.